Welcome back. In this part of our series, we're going to talk about gathering information that's needed in order to make a good decision when it comes to purchasing your health and life and disability benefits. No matter where you're purchasing, there should be plan details or summaries of what those plans are going to pay for. So we want to make sure that you gather any information that you have either researched and found on your own or been given by your employer or broker working with you on your Medicare or Medicaid policies. We want to get all that information so that we can compare it to what options you might be looking at going forward. Important documents that you should have available to you in most situations is going to be a summary of benefits and coverage. This document's going to be very similar if your husband brings home a plan or your wife brings home their plan. The documents from both should look very similar. This was an intent to give you something that made it easy to compare insurance plans. Even us as brokers find it frustrating when everybody's plan designs are very different. So gather up that plan information so that you have all of the details in front of you to look at. Then we're going to need to identify some of the details that are needed to make a good decision. Are there other coverages outside the information that you've gathered for yourself that would offer you another comparison to make? Who are the important contacts that you might need to reach out to? Maybe there's some questions that aren't real clear in the documents that you would really like to have someone to go over with you. There should definitely be telephone numbers for myself. If you don't have anyone to reach out to, you certainly should reach out to me. But even the carriers have provided information in their documents to you, so you can get some access to the professionals that actually wrote the plan for you. You need to understand also what are the important activities that you need to complete in order to actually enroll in the plans. And so understanding the steps about how we're actually going to get our information to the carrier and effectuate your plan, meaning actually pay for it and get the information back saying you're approved and can use your benefits. It's also really important to understand the timing of how you execute your enrollment or when you make these plan elections. Oftentimes there's deadlines. For the individual side of the market, if you are enrolling and want to have coverage on January 1st, generally speaking, you have from November 15th to December 15th to make that election. If you miss your open enrollment period, you could be without benefits for an entire plan year. So it's important that you don't miss the deadline. So identify when those deadlines are and make sure that they're marked on your calendar and you don't miss them. It might also happen to be that you have to go to more than one site to enroll in benefits. So it's important to understand, are there benefits that you enroll in one area and you have to go to a separate entity or another application to enroll in another? Sometimes benefits are split up that way. So it's important to understand that you've got all the access points and all the information needed to make decisions.